Hi everyone, my name is Garrick Zaleski, and I'm excited to share what I've learned from my research about treating ADHD in elementary schools. So in this presentation, I will explain what ADHD is, how prevalent it is, the effects it can have, the impact it has on parents as well as teachers in the education system, and then most importantly, what we can do to most effectively treat ADHD. So first, what is ADHD? Attention deficit hyperactivity disorder is a neurodevelopmental disorder that usually begins in childhood and in some cases can move on with them into adulthood. It's characterized by patterns of hyperactivity, inattention, impulsivity, and these are all things that interfere with their normal development. So how prevalent is ADHD? This is one area of study that is really difficult to really put a number on because it depends on what test you're using and what criteria you use in that testing. But most studies find about 5% of children have attention deficit hyperactivity disorder. But this range can be anywhere from 2 to 15% worldwide. It just depends, like I said, on what methods you use to test, what criteria you're using, what population you're studying, if it's just the United States or worldwide or other specific countries. And so the prevalence is really hard to determine, but we do know that it is very prevalent. And one thing that is for sure is that the prevalence of ADHD is on the rise. Each study reports an increase from year to year. And this is unclear uh, if it's just due to more testing or if more students and young teenagers are getting this disorder, developing this disorder, or again, if it's just the increase in testing. The effects of ADHD are quite severe, especially on education. So a case study found that 70% of studies found a negative correlation between ADHD and mathematics. So the majority of studies on ADHD show that there's negative correlations, specifically with math, but also with other subjects as well. Students with ADHD often are two standard deviations below typically developing peers. So this puts them behind and they keep falling further and further behind as their peers keep moving forward. It's harder and harder for them to catch up, these students with ADHD. The main cause of this is that the current education system is not tailored to accommodate students with ADHD or other developmental disorders. The current classroom structure is set up that there's one teacher and multiple students, and the students are expected to listen to the teacher, to sit down, to be quiet, and to do their work. There's not a lot of room for creative thinking, for thinking outside the box, from moving on from this sit down and be quiet type of teaching style. Whereas a student with ADHD really can succeed more when there's more creative, more active learning. Sometimes they learn best with their hands, so having hands-on activities is really important. And there are some teachers who really try and do that, but the majority of studies show that a lot of teachers expect their students to sit down, to be quiet, and to just do their work as it is given with little to no creative input. So there are not only negative effects in schools, but also in social life and emotionally. So there are increased rates of low self-esteem, family and peer relationship struggles, and disruptive behaviors in students with ADHD. There's also higher risk of accidents, injuries, teen pregnancies, criminal behavior, and incarceration once those students reach young adulthood and into adulthood. Whilst most young students who develop ADHD do grow out of it, they don't always grow out of the negative effects. They have been put behind in so many ways, it's really hard for them to catch up, which leads to these accidents, these injuries, and even the criminal behavior and incarceration. There are also significant economic impacts of ADHD. One study estimates that children with ADHD cost up to 17.6% more than their typically developing peers, and that cost is in health services. So whether that's doctor's visits, therapy visits, other medical needs, uh, That's where that number is coming from. But there are also negative effects, costs in terms of time and effort. These are things that we can't really put a number on. How much is your time worth? It really depends. But one thing we do know is that students with ADHD require a lot of extra work and a lot of extra time. And that's definitely a cost associated with ADHD that is hard to address. ADHD doesn't only affect the student, the patient who has been diagnosed with the disorder, but it also has a significant impact on parents. Most parents who have children with ADHD report lower quality and feeling worse about themselves and specifically about their parenting. They are more easily frustrated, they're guilty, they have lots of stress, especially as it really regards to their parental role. And that's something that it can turn into a negative spiral really quick. Once a parent starts feeling poorly about their parenting skills continue to decrease as that confidence drops. And it just keeps going further and further down until they have no confidence as a parent. They just don't know what to do with their child. They also don't know how to discipline their child. And a lot of these ADHD has a really high comorbidity rate, which means that it's really often paired with other developmental disorders. These behavior issues that are associated and come with ADHD can make it really hard to know how to discipline your child, which is an important part of parenting, but a very difficult part of parenting, especially for students, for patients with ADHD, along with affecting parents. ADHD has significant impacts on the education system, and this is where I have seen it the most. I have had opportunities to volunteer in elementary schools and elementary school programs for the past few years, and part of my job is to work specifically with students who are behind on their schoolwork. And a lot of these students have ADHD or other developmental disorders. And so I am there as a volunteer to help them with that. And so this is where a lot of my experience with ADHD comes from. So there's a lot of effects that have previously been mentioned that children with ADHD encounter, and these behaviors or these effects lead to disruptive behaviors, and these disruptive behaviors can impact everyone in the classroom. If one student is standing up and moving around because they are having a hard time sitting down and focusing, it soon distracts the rest of the students around them and they start to be disruptive as well. It can have a really negative effect. So when I was in elementary schools, the majority of times I would take students in one-on-one or small groups to help them with their math or their language arts, whatever we were working on, just so they were away from the group so that they weren't being as disruptive. Children with ADHD often develop conduct uh, often develop authority disorders, and this can make it really hard on teachers. It was something that was hard on me as an authority figure in those elementary schools. There were some students who really just didn't want to listen to me because I was in a position of authority over them, and that makes it really hard for them to progress in their school life, and it can lead to those problems that were mentioned earlier, like the incarceration and the teen pregnancies, things like that, can be caused by these other disorders that are often associated with ADHD. So now we understand that ADHD is really a problem in schools and in homes, and it's really something that needs to be treated. So how do we treat it? First, we look at the history of how it's been treated. Most parents rely on medication to treat their child's ADHD. I worked in a pediatric office, and one of the doctors specialized uh, in treatment of ADHD with medication. He had many patients that would come in just for ADHD medication checks. That was a majority of his day was just checking in on kids, making sure their meds were working, and it was really interesting to see because a lot of these kids would come in and they were either really hyper and you could see that the medication was really hardly working at all, or they were really just lethargic and really didn't feel like themselves, or what it would seem like they would be off the medication. And so that was something that really interested me is why are these medications so prevalent in treating ADHD and are they the best method? And most studies indicate that medication really does not have a large effect on academic achievement or social skills on its own, which is why it's important to pair uh, medication with other treatment methods, which we'll talk about in a second. So there's also attempts to treat ADHD in schools through policy adopted by lawmakers. One study that I found went into an example of a policy in Denmark. And this policy, the goal was to increase inclusion of special needs students, and this included students diagnosed with ADHD. So they had this policy, but there was no formal training offered to educators in Denmark. So the lawmakers said, you, as teachers and educators, need to be better at including students with special needs, including ADHD. But they didn't tell them how. And so, due to this, the teachers reported increased rates of work-related stress since the policy was implemented. There was a huge disconnect between policy and practice. The lawmakers said one thing but didn't give the proper resources to make that happen. And so it ended up making things worse for the teachers and the students. And so that's something that really needs to be addressed. There needs to be policy in place, but there also needs to be proper practice and ways to implement the policy that make it effective. So each of the research articles that I read came up with treatment options that were most effective. Highly effective treatment involves a combination of social and pharmacological intervention. So this pairs medication with therapy or medication with one-on-one interactions with teachers and any other range of social intervention is possible. And that is very, very effective, much more effective than strictly medication. Um, there's also an indication that providing education to parents and to teachers can help them, those parents and teachers understand their student and their child to understand how to best treat them. There's not one way to raise a child, especially not a child with ADHD. And so it's important that there is education, extensive education on different ways to treat, not just one way or two ways, but many different ways so that a parent or a teacher can understand where their child's head is at because it's not the same as maybe their head was when they were that age. And it's really difficult to help those kids if you don't know what's going on. Multimodal intervention, which is the combination talked about previously, is also extremely effective when you include your parents and your teachers and your doctors all on the same page. So the most effective way is a personalized treatment plan, which is what I was just talking about. We have the patient at the center or the student, the child, whoever's diagnosed with ADHD, they're at the center of this treatment team. And then around them, you have a support system, including the parents, teachers, and other educators, specialist volunteers like I was. You have your medical side, so you have your doctors, your nurses, anyone who understands. And then you also have maybe a therapist involved, whether that's provided through the school or a private therapist, some sort of other intervention involved. And you have this entire team, this entire support system surrounding this child. And that helps them to treat their ADHD the most effectively. And once that is treated, they can avoid those negative social effects that we saw that are so prevalent and that are so important to avoid so that they can progress in life just like the rest of their typically developing peers. So here I have my references. All of the information I had presented can be found in these articles from peer-reviewed journals. Thank you for listening to my talk, and I hope to answer any questions that you have. Thank you.